At Northeast Regional Medical Center in Kirksville, they have established a 30-minute or less ER service pledge, and that's where we can find our Brandon Smith live out there this morning. Hey, Brandon.
Hey, good morning, Ella. I'm hanging out here at Northeast Regional Medical Center with Eric Barber, the CEO, and we're talking about their new 30-minute or less emergency room pledge. And I guess you guys started this in July
1st.
July 1st. I guess to kind of talk a little bit about that program.
Sure. Well, as you may be aware, nationwide, emergency rooms are crowded. Wait times are getting longer. 4 to 8 hours is pretty common in some of the larger cities. And so here at Northeast Regional, we've taken that very seriously. We recognize that it's a priority for a patient to be seen as quickly as possible. And we actually want to use this 30-minute pledge as a message to the community that we recognize that issue and that we are making it a priority to get them in front of a physician as quickly as possible, specifically within 30 minutes or less.
And like I said, you guys started this in July, but you guys did a little testing period, I guess. So far, what have you guys learned about this?
Yeah, it's interesting. We before we rolled out the pledge, we spent about 6 months proving to ourselves internally that we could actually meet these times. And it was interesting because some of the bigger skeptics were the physicians and the nurses who said, this is very unpredictable. Patients can show up in large groups. We're not sure we can do this. And now here we are. As of July 1st, everyone's pretty excited, and we are meeting those times very consistently. And some of our bigger skeptics, some of our nurses and physicians are now some of our bigger champions who are excited about this campaign.
And just quickly, you guys can track, the patients can track their time and stuff like that, correct?
Correct. We have a computer system called ProMed, allows us to recognize when the patient walked in the door, how long they've been waiting, when they were seen, and then, of course, when they were discharged.
Okay, well, Ella, that's just a little bit about the program. Hang with us, and we'll talk a little bit more about it after the break. Ella, back to you.
Talking about their 30-minute or less ER service pledge. Hey, Brandon.
Good morning again, Ella. I am here live at Northeast Regional Medical Center, hanging out with Eric Barber, the CEO here, and we're talking about the 30-minute or less emergency room pledge and kind of talk about some of the misconceptions about that pledge.
Yeah, it's interesting. Whenever we started this pledge, some people ask me, they're like, wait a minute, does that mean I have to wait 30 minutes to be seen by a physician? And truly what it means is that 30 minutes is a benchmark for us. And as an example, if a patient shows up with a very common diagnosis of chest pain, we're going to get them in front of a physician very quickly. Similar would be if they came in through the back door with an ambulance from some kind of a trauma. We are a level 3 trauma center. They would be seen immediately. And so we use the triage process to make sure that we're trying to meet that 30-minute pledge. And that 30-minute pledge acts as a benchmark or a reminder to our staff that, hey, this patient's been waiting near that time, and it's time to get them in front of a physician.
We kind of talked about this earlier, but just talk about, you guys are a hospital, but how important is it just to reassure people that you guys did this pledge and letting them know that you guys are serious about getting them in?
Yeah, I think this pledge gives us an opportunity to let the community know that we have made some very positive changes in our emergency room, and that we're committed to making sure that we're doing everything we can to get them in front of a physician as soon as possible, recognizing that it's a nationwide problem with crowding and long wait times.
And this program is free, right? No charge, correct?
No charge.
And the most important, maybe, right?
Absolutely, yes.
All right, well, appreciate you. Thanks for joining us this morning.
You bet. Thank you for having me.
Thank you. And Ella, 30-minute pledge. Very good program, started July 1st, and they've been doing a very good job on enrolling it. Ella, back to you.